Welcome back. April is Oral Health Month, and joining us to talk about this today, we have Dr. Preeti Desai joining us. She is a periodontal specialist. It's lovely to have you on the show.
Thank you, Susan.
Yes. So I thought we'd start with a sort of a basic premise about the fact that your oral health, believe it or not, is very directly linked to your overall physical health. Can you speak to that?
Yes, absolutely. There's been so much research done now to link your oral health, your risk of periodontal disease, to your cardiac condition, the lungs, the liver, and rates of cancer as well.
What are some of the first things that happen to somebody if they have really poor oral health physically? What are some of the more common things that can happen?
If there is a high risk of periodontal disease, you will see bleeding gums, you will see teeth that are wiggly in the mouth, and it also increases the immune reaction, meaning your whole body is feeling the infection.
If you don't floss regularly, you run the risk of having some of that plaque enter into your bloodstream. Is that true? And if so, what does that do?
Absolutely. There's 2 or 3 big studies that have just come out linking your oral health to cardiac problems and stroke, heart attacks, and now lesions in the brain.
Lesions in the brain, really?
Yeah, they have found plaque bacteria in the brain, in the heart, in the lungs, and other body parts as well.
Now, I have a fact sheet that says that periodontal, which is gum disease, affects 87% of our population. So this is obviously a huge problem, and a lot of people aren't doing anything about it?
Well, I think the intention is there of the BC Dental Association and our national body to bring awareness. And awareness is power. And when people have that power to take over their own health, they read about it, they ask the right questions to their dentist, that's how you can get control over it.
I just had a flashback from my childhood when I used to be sitting in the dentist chair. You know how you lie back and there's always posters on the wall, you know what I'm talking about, or on the ceiling?
On the ceiling,
And
yeah.
the one that always resonated with me was, you don't have to floss all your teeth, just the ones you want to keep.
Exactly.
And I thought, well, I better get on the job, right?
And there you go, awareness and education, right?
Absolutely.
It starts right from childhood.
Absolutely. What other tidbits of information can you share with the public about what people should be doing to ensure that they're not missing something?
Part of the awareness campaign by our BC Dental Association is to say the dentist can see things that you cannot. So early diagnosis is so vital. It is the focus. The mouth is the most important part of the body. Obviously, I'm biased, but it is the area where we communicate our emotions by smiling. We bring in nutrition by eating. So the mouth is so vital. And if we can identify and diagnose things early, the success rate of cancer treatment, for example, in the mouth is 80 to 90%. But if you leave it longer, it's about 50%.
How prevalent is mouth cancer? Is it quite prevalent? I mean, obviously in a smoker, you're going to see a higher rate. I have a friend who actually ended up getting tongue cancer, and she's not a smoker. She's never smoked. It's never smoked a cigarette in her life. How does that happen?
Well, there's a number of etiologies that are identified. Smoking and alcohol abuse is the #1. But there is a genetic predisposition as well in about 7% of people who get tongue cancer, for example. And now more recently identified as HPV-16, which is the papillomavirus that's associated with cervical cancer.
Right.
And in the last 5 years, that rate has skyrocketed to the point now where close to 650,000 people in the world have mouth cancer.
Really?
Yes.
Really? So how often should people floss? Every day, sure. But in the real world, every day it doesn't necessarily happen. If you're flossing 4 or 5 days a week, is that good enough?
You know what? Obviously, the more you can do, the better. Daily is ideal, and more importantly is what time of day do you floss. If you can floss just before you go to bed or right after dinner, which will prevent snacking, if you're going to choose one time, that will be the time to do it.
Okay.
So you don't sleep with the stuff.
Okay, good to know. Are people still getting cavities at the same rate that they always have, or are we getting better?
We are definitely getting better, and that is a function of the public awareness campaign that, you know, oral health is all about. It used to be called Dental Health Month, but it's not just about the teeth anymore. So we've succeeded in almost, I wouldn't say eradicating cavities, but we don't lose teeth from cavities anymore. We lose teeth from periodontal disease.
Okay. So at your office, you were just saying to me before that we came out of the break, you're often a referral-based business. What are some of the things you specialize in then?
A periodontist is a specialist in the treatment of gum disease, periodontal disease. We do quite a bit of tooth replacement as well with dental implants and bone graft surgery if someone is going to lose a tooth, to pre-plan how to replace that tooth the best by different grafting techniques to make the mouth as healthy as it was from the beginning.
Fantastic. And what is the latest and greatest with what people are doing these days? I know there's so much technology. I'm sure there's really great things that you guys can do now.
Like any industry, technology has made our lives so much more sophisticated as far as the delivery of treatment, and things like laser treatment for cavities or gum disease treatment instead of traditional surgery has made my life so much more pleasant to deliver treatment to a patient who's like, oh, I don't want surgery. The fear factor of, dentists have got such a hard rap sometimes with like Mr. Bean, skits and stuff. But it's made, there's so many things to make the patient feel so much more comfortable in the chair.
So don't
and we're not
delay.
Scary.
Don't be afraid of going.
Don't be afraid.
That's
don't
absolutely.
Be afraid.
So still it's recommended twice a year for your daily checkups. That's still the going rate?
That's the average.
Yep.
There's a lot of people who have the periodontal disease that actually need 4 times a year.
Yeah. Oral is, April is Oral Health Month. So if you haven't had your biannual appointment, you should be going in and checking it out. A little reminder today.
Absolutely.
Thank you so much for being here.
Thanks, Susan.
All right, you're very welcome. The information's on the screen. If you would like to learn more, make an appointment. Phone number as well as the website is there. We will take a 2-minute break. When we come back, your midweek weather forecast. Stay with us.